Good afternoon, everybody. Thank you, as always, for joining us for this update. I want to start, as I always do, by updating you on some of the key statistics in relation to the spread of the virus in Scotland. I can tell you that as of 9 o'clock this morning, there have now been 11,353 positive cases confirmed. That is an increase of 319 since yesterday. A total of 1,748 patients are currently in hospital with either confirmed cases or suspected cases of the virus. That's an increase of 21 on yesterday. A total of 109 people last night were in intensive care, again, either with confirmed or suspected cases, and that is a further decrease in that number of 5 since the figure I reported to you yesterday. I'm also able to confirm on a happier note that since 5th of March, a total of 2,538 patients who had tested positive for the virus and been admitted to hospital as a result have now been able to leave hospital. However, on a sadder note, I also have to report that in the last 24 hours, 60 deaths have been registered of patients who have been confirmed through a test as having the virus, and that takes the total number of deaths in Scotland under that measurement to 1,475. These numbers, as I stress every single day, are not just statistics. They represent people who are right now deeply missed by their friends, their families, and their wider network of loved ones. So once again, I want to send my deepest sympathies and condolences to everyone who has lost a loved one to this virus. We are all thinking of you at this time. I also want to thank, as I always do, our health and care workers. At 8 o'clock this evening, I will join, no doubt, many of you across the country in applauding our health and care workers in what I think has become a very precious and very special moment in the week. And to health and care workers that might be watching right now, I hope that this shows you, albeit in a symbolic way, just how grateful everybody across the country is for the extraordinary and very courageous work that all of you are doing. Now, there are two things I want to talk to you about today. First of all, I want to take the opportunity today to emphasise the vital importance of sticking with the lockdown restrictions at this time. Now, I set out last week, exactly a week ago today, our decision-making framework for starting slowly and gradually to ease aspects of the lockdown when it is safe to do so, and the factors and the uncertainties that we will have to take into account as we make these difficult decisions. And I promise to be open with you as our thinking and our decision-making develops, and I absolutely will be. I intend to update you again next week ahead of the next official review date of the 7th of May on our considerations and our judgments so far. And I'm very grateful to all of you who have taken the time to send us views on the paper that we published a week ago today. But part of the grown-up conversation that I want to have involves me being willing, when necessary, to deliver tough messages, as well as hopefully the more positive messages in time about how, when it's safe to do so, we can start that journey to what I described last week as a new normal and start to reduce some of the harms to the economy and our well-being that we know the lockdown restrictions are having. But right now, that need to deliver tough messages means that I have to be straight with you that it may very well be too early, even this time next week, in any meaningful way to safely lift any of the current restrictions. And I want to share with you today the reasons for that. We have worked very hard as a country to bring down the transmission rate of this virus, and we are definitely seeing results from those efforts, and I want to be very clear about that today. In fact, we see, as I report to you every day, that fewer people are now in intensive care than 2 weeks ago, and that figure appears to be reducing now on an ongoing basis. And hospital admissions, while they're still fluctuating, as you've seen today, are also on a slowly reducing curve. Overall, we think that transmission in the community of the virus has been reduced very significantly as a result of the lockdown, although, of course, we know that it remains higher in settings such as care homes, for example. The R number that you have heard us talk about before, the rate at which the virus reproduces is, we believe, now below 1. And remember that at the start of lockdown, we think that it was above 3. So that is real and very positive progress. And that progress matters. With the R number below 1, that means that every 100 people with the virus, between them pass it on to fewer than 100 more people, and so on and so on. So the total number of cases will gradually decline. And we do think that is happening now. However, we are not confident that the R number is very far below 1 yet. And that means any easing up at all in the current restrictions, either formally by government decisions or informally by people becoming a bit less compliant as we all get more and more weary and frustrated, would quickly send it back above 1. Indeed, there have been reports in the last day or so from Germany that their R number is rising again as a slight easing up there has been taking effect. And if the R number does go back above 1, let's say it goes to even just 1.5, then our 100 people from a moment ago would between them transmit the virus to 150 people. They in turn would pass it on to 220 people, and so on and so on. And suddenly the virus is spreading exponentially again. And that would mean more people in hospital and intensive care, and even more people dying. So the point I'm making to you today is not an easy one, but it is an essential one. The progress we have made is real and it is significant, but it is still very fragile. The margins we have for ensuring that the virus doesn't take off again are really, really tight. That means we must be very cautious at this stage. And it's why it is so important that everyone sticks with the restrictions. And in recent weeks, people, all of you, have been absolutely superb at doing that. And I will never be able to tell you how grateful I am to all of you for that. You are the reason that the NHS has not been overwhelmed, as I really feared a few weeks ago that it might be. And by sticking to the guidance, while we are seeing horrible, grim numbers every day of people dying, by sticking to the guidance, you have undoubtedly saved lives. However, we are now seeing slight increases in, for example, people using our roads. In addition, we're seeing some increases in people using concessionary bus travel than we were a few weeks ago. Now, both of these trends, let me stress, are from very low starting points, but they are still a source of some concern to us right now. For example, the number of people who are using concessionary transport increased by almost 1/6 last week. The car traffic we've observed on major roads is less than a third of its pre-lockdown levels, but it has increased this week by about 5% compared to last week. On some of our town and city roads, traffic has been 10% higher than in the week before. So what I'm asking all of you to do today, and you know the reasons that I'm asking you to do this, is think about whether or not it is the case that right now you're a little bit more active than you might have been at the start of lockdown, and to ask yourself why that is the case. Was your journey really essential? You might think it's only you making an extra journey and that it's only one trip, and you might well feel you deserve it after weeks of restraint. Believe me, I really understand all of that. But all of it adds up. And the fact remains that if everybody starts easing off, the virus will quickly take off again, and it will have devastating consequences for all of us. I know this is a long haul. I know people want to travel a bit more. I know that children want to spend more time outside. I absolutely know that every grandparent watching this right now is desperate to see and to hug their grandchildren. But as things stand, our progress against the virus, albeit very real progress, is too fragile for us to let up. But the more we do to stick to the lockdown, the more we will reduce that R number below 1, and the lower it goes, the more scope we will have to ease the lockdown measures in future. So please, I'm asking you today again, please stay at home except for essential purposes. If you do leave home, remember to stay more than 2 metres away from other people and don't meet up with people from other households. And if you have symptoms of the virus, you and your household should isolate completely. And everybody, of course, should still be washing their hands thoroughly and regularly. By sticking to all of that, we can keep that R number below 1, we can drive it even further below 1. And we will slow the spread, we will continue to protect our NHS, and we will save lives. And while it might not feel like it right now, I'm pretty sure it doesn't. By doing that, we will actually all help each other to come through the other side of this a bit more quickly. Now, the other thing I want to briefly update you on today is our support for business. I can say that today 3 new business support funds, which total £100 million, will open for applications, and they're part of a wider package of measures to support business, which are worth £2.3 billion in total. One of the funds is the newly self-employed hardship fund, which is being managed by local authorities. And that's open to newly self-employed people who are facing hardship, but because they have become self-employed in the last year, are not eligible for other support. And they will be able to apply for grants of £2,000. The lack of support for newly self-employed people is something that has been much commented on, so I am glad we're able to do something now to give assistance. The second fund is the Creative Tourism and Hospitality Enterprises Hardship Fund, managed by our enterprise agencies with support from Creative Scotland and Visit Scotland. And that will provide grants of up to £25,000 for smaller creative tourism and hospitality companies who don't benefit from business rates relief because they might not have premises which can benefit. And finally, we've also established what we're calling the Pivotal Enterprise Resilience Fund, again managed by enterprise agencies. This will provide grants and support to small and medium-sized businesses which we think are potentially vital to our economic future or to the economies of certain local areas, but which are being made very vulnerable by this crisis. And this particular fund is a really important way to try to safeguard our economic future and potential by ensuring that smaller companies with lots of potential are not driven out of business during this crisis. Application for these funds will be open from 2 o'clock today, and we hope that successful applicants will start receiving money in the next couple of weeks. So if you think you might qualify for one of these grants, you can find more detail at www.findbusinesssupport.gov.scot. Now, I want to just end by reiterating my earlier message. Please stick to the guidance. I know this is not easy, and when I say that, I'm not just saying what I know you want to hear. I really know this is not easy, but it is making the difference. So please, please stick with it. Now, I'm going to hand over to the Chief Medical Officer, but can I just firstly, before I do, alert you to the fact that tomorrow's briefing will give a substantial update on our position on testing. And it will set out where we have reached by the end of this month, which we will know, of course, by the time we get to the end of today, which is the end of the month, on our performance against the targets we set to build NHS lab capacity to be able to do 3,500 tests per day. And we'll also set out progress on the numbers of tests we are doing today. So if you're interested in that, tune in for that tomorrow. If I can hand over now to Dr. Gregor Smith, and then we'll go straight to questions. Of course, the Health Secretary is here and will be participating in the question and answer session. Gregor.
Thank you, First Minister. Last week I highlighted the vital contribution the clinical research community within our NHS is making to the fight against COVID-19. Today, I want to share something of the work that our universities are contributing towards that same goal. Last month, the Scottish Government's Chief Scientist for Health issued a call for rapid research. The response from Scottish universities and research institutes to that has been quite exceptional. A little over a month after the call was issued, the applications received have been reviewed by independent experts, and the Cabinet Secretary for Health and Sport announced to Parliament this week that 15 of our universities and research institutions will be embarking on a programme of 55 research projects with a total funding package of almost £5 million. These projects will build upon the excellent academic expertise that we have in Scotland, providing new knowledge across a broad range of areas. They'll help us better understand the effects of infection so we can improve how we treat and manage the disease. They'll also help us to develop and test new ways of diagnosing the disease and approaches to treating it. Some of the research will look at ways in which we can track the disease in the population and ways in which transmission of it can be prevented. Other projects will support research into the impact of the disease on the health of health and social care workers and what we can do to support that. We also want to understand the physical and mental health implications of social distancing and other restrictions that have been introduced, So some of these projects will look at the impacts of these on the general population, as well as in some of the specific groups, vulnerable groups such as older adults, those who are shielding, vulnerable children and young people. Of course, Scotland's also actively participating in research efforts coordinated at a UK research level as well. The National Institute for Health Research leads a prioritisation process for research at a UK level. Leading clinical experts from across Scotland, including the Chief Scientist from the Scottish Government and colleagues from NHS Research Scotland, actively participate in this process. That means through working together with partners, Scotland can lead, enable and deliver world-class research to gather reliable evidence. This work is funding and supporting a range of research to better understand and tackle the disease, including research into vaccines, into treatments and into diagnostic tests, as well as the real-time collection of samples and data from people undergoing treatment in hospital. We're incredibly fortunate to be benefiting from the commitment of outstanding clinical research teams across the country and from the world-class research infrastructure and expertise that is part of both our NHS and our academic institutions. And of course, for the support of those patients and individuals who have agreed to participate in these critical research studies. So I simply wanted to thank everyone involved in this vital work at every level. Your contribution is an essential part of our response to COVID-19, and I want you to ensure that you know that you're making an incredible difference.
Thank you, Gregor. We'll go straight to questions now. The first question comes from Lisa Summers from the BBC.
First Minister, we know now that there is evidence that testing people who don't have symptoms is important if you're going to stop the spread of the virus. You've already said that you will do this for patients in hospital who are over 70. Will you commit to testing asymptomatic people in places like care homes or in other vital services?
So I said at the end of my remarks that we're going to have the major focus tomorrow in this daily update on testing. That will be a progress report, but also we will set out tomorrow what the next steps are in our extension of eligibility for testing. Your point about testing asymptomatic people is an important one, though. We still have to insert the caveat that this test is not necessarily as reliable in people without symptoms as it is in people with symptoms, but as evidence emerges of asymptomatic or pre-symptomatic people shedding the virus, of course it becomes more important that we try to apply testing there. So we've already made that extension to certain categories being admitted to hospital, and we're considering that now in the context of care homes. But if you forgive me, this is going to be a substantial update that we give tomorrow, and I'm happy to go into the detail of that when we do so. Ross Govins from STV.
Yes, First Minister, there are still issues with PPE in private sector care homes. Why are so many still having to rely on donations from individuals and organisations? And given the current tragic death toll across all care homes, should families of residents and staff still consider them a safe setting for their loved ones?
I'm going to hand over to the Health Secretary, but our responsibility working with care home providers is to make sure that care homes are as safe as they possibly can be. Obviously, in the context of a global pandemic of a virus that has no treatment and no vaccine, and that we know particularly affects older people. Let me also say no member of staff in a care home should rely on donations. The principal responsibility to provide protection to staff is on the part of the care home provider, and the government's responsibility, as we have been undertaking, is to top up where required these PPE supplies, and we've been working hard to do that to make sure that the distribution routes are as effective as they can be, and we'll continue to work with care homes to make sure that care home staff have the protection they need, and any who don't should be raising that with their local management, and of course they still have that email address where if they can't resolve it locally they can come direct to ministers. Jeane.
So I want to add to that, just to remind everybody, including any care home staff in particular who might be watching this, of the ways by which we assist your care home provider to have the PPE that you need to protect yourself, but also to protect the residents that you care for. So as the First Minister said, the primary responsibility is, of course, with your care home provider. But many weeks ago, we recognised with Scottish Care that in the global demand for PPE, care home providers may be hard pressed in terms of their normal supply routes to secure all of the PPE that they would need. And we agreed that our NHS stockpile of PPE and our distribution routes would take on an additional responsibility to provide PPE where that was needed to social care. That is both home care, the care of individuals in their own home, but also to care homes. And we have established a dedicated order line, a dedicated supply route, and about a week ago, we put out a week's worth of supply, not against demand, but in order to ensure that all care homes had at least a week's worth of supply directly delivered to each individual care home, all 1,100 or so of them. That was to ensure that no matter what, no matter where they were at that point, they had that cover, and that they would then look at how they could continue to use their own suppliers, but come to us where that was not working out for them, or delivery dates were late, or whatever the problems might be. I speak to Scottish Care every single week, at least once a week. My officials are in contact with them constantly, as well as all the work that goes on in our National Distribution Centre and Procurement Centre. So let me repeat what the First Minister has said. If anyone has difficulties in securing the PPE they need to let me know that. And that particularly applies to social care staff and care home staff. Some of you have contacted us, and when you do that, we act very quickly to ensure that you are being given the right guidance, the right PPE, and if there's a problem, we act to help you solve that.
Thank you. Jim Matthews from Sky.
Thanks very much, First Minister. You said you're going to make announcements tomorrow on testing, but can you tell me today, has anyone at all been subject to the test, trace and isolate regime? And also, possibly for the Health Minister, you have said that people admitted to care homes from the community will be tested, but care homes are being asked to take these people in from the community and then test them. 2 care homes have told me that's a risk and places an unfair burden on the care homes. Can I ask your reaction to that?
Well, if you want to give us the detail of the care homes you're talking about, we will obviously look into that. But in terms of how testing is done and how it is safely done, it is important that Health Protection Scotland and experts are guiding that and informing that. In terms of the first part of your question...
It's a blanket instruction. It's a blanket instruction, First Minister.
But I will look into that and we'll come back to you. And it would be helpful as well if you provided even confidentially the care homes you're talking about. On the first part of your question, I'm not sure I entirely understand it. We're not yet operating a test, trace, isolate approach. We will do that as we go into the next phase. We are currently building the capacity for that. Our current testing is following the objectives that we set out at the start of this phase, although some of those categories have been extended, not least in terms of symptomatic residents in care homes and people being admitted to care homes. Separate to the update I've already alluded to for tomorrow, I think I said yesterday or the day before that at some point next week we'll also do one of these briefings dedicated to test, trace, isolate and how we're building that capacity and how that fits within the next phase of tackling the virus. Peter McMahon from ITV Borders.
First Minister, thank you very much. Going back to your clear message that there won't be any significant lifting of restrictions from next week, could I just ask you about building? The Federation of Master Builders today are saying builders face financial collapse. If it's possible in Scotland for vital projects to carry on, building projects presumably with proper social distancing, and if it's possible south of the border for building work to go on, again, presumably with proper social distancing, wouldn't it be possible for the Scottish Government to look at how that is done and then work out a way of getting builders back to work, which would mean a lot more people in employment and potentially have a big mitigating effect on the economy, which, as we all know, will be devastated by coronavirus?
We look at these things on an ongoing basis, not just for construction, but across the economy. We have the essential, non-essential distinction generally built into our approach here, so that's not exclusive or unique to construction. We've made judgments, and as I keep saying, these are judgments that I make and the government makes based on the best advice because our duty is to try to protect the Scottish population as far as possible. And the judgment we've made so far is that unless it's essential, that it is not safe for construction sites to operate as normal, but we continue to keep that under review, and these will be evolving decisions over the next period. As I said in my remarks today, what I'm signalling to people, in order that these things don't come as a great surprise, that it is likely that by the time we get to this time next week, which is the 7th of May review date, we will not be possible to in any meaningful way lift these restrictions. Of course, we will make the final decision around that next week at that review point, but I want to be as open as possible as we go along here, and that's what I'm trying to do. Our assessment right now, as of today, of the data and the evidence is that it would not be safe to do that. But of course, in the days to come, up until the 7th of May, we will keep that under very careful review. Charles Fletcher from Caledonia Media.
Good afternoon. Thank you, First Minister. Community radio, as you know, across Scotland is delivering a lifeline service. That's mainly through goodwill. But because of the pandemic, stations are losing income they get from events, advertising and sponsorship. Some are possibly going to close. What can the Scottish Government do to support local media and specifically community radio?
As I think you know, Charles, I'm a big supporter personally of community radio. I see the benefit of community radio and the great impact that they have in my own constituency and further afield in Scotland. And I don't underestimate the impact that what we're living through right now is having on community radio, but local media more generally, just as it's having an impact on the rest of us and every other sector of our economy. I'm not going to have these updates become sort of opportunities for me to make policy sector by sector on these issues in response to questioning. I don't think that would be fair to community radio or anybody else, but we will continue to have ongoing conversations in general with every sector of the economy about how we can provide maximum support, and we'll be happy to take that discussion forward with community radio as we do with others as well. Craig Payton from PA.
Thank you, First Minister. Today you've urged people to continue to adhere to the lockdown regulations. Has there been any talk within government of more oversight, perhaps with the police or other partner agencies, over where people are going and why they're going there? And what is being done to counter the frustration that you alluded to that's being felt by people who have been forced to stay in their homes?
On the first point, the powers that the police have right now, I think certainly at this stage are proportionate and appropriate. The police obviously are operationally independent. It's for them to decide how they use those powers, but the Chief Constable has said repeatedly that they want to use them very sensitively and use enforcement as a last resort. And I think the figures that have been cited on a regular basis demonstrate that they are very much a last resort. Obviously, and this is not necessarily attached to the point about enforcement, but more generally, as you will probably pick up from my comments earlier on, we're looking very carefully at the data we've got on transport usage, on how busy our roads are, where people are going, so that not so much so that the police can enforce that, they're doing a good job already to decide when enforcement should be used, but so that we can say to people, as I've done today, look, the data tells us a few more of you have been on the roads recently or on buses recently. Can you please think about whether that has been essential? On the second part of your question, look, I don't have the magic answer to that. Everybody's getting really frustrated about this. I mean, it's weeks now, it may be some weeks longer. It's tough for all of us. And as I've said before, while we're all in some respects having to live with fundamental changes to how we're living our lives, that's much tougher for certain groups of the population, people with children, people who don't have gardens, people who are living in tenement flats, for example, much tougher than somebody who can go out and sit in the garden. So I am acutely aware of all of that, and I can't wave a magic wand and make that frustration go away, because people are human. What I can do, and what I need to do though, is tell you why it's necessary and persuade you why it's necessary, which is why I think it's so important that I'm as open as possible, because I need you to believe me when I say I'm not asking you to do this for no reason. I'm asking you to do it because it is for your own sake and for the sake of your loved ones, particularly your older loved ones, because if we allow this virus to run out of control again, then I'm going to be standing here for a lot longer giving you even more grim statistics. I don't want to be doing that, and I don't think you want me to be doing that either. So, I can't stand here and say anything that makes this less awful for people. But I can and I must continue to persuade you with everything I've got of why it's necessary. And that's what I will keep doing. But the last point I'd make is I won't do it for any longer than I absolutely have to. I want to start a process of getting back to normal as quickly as we can. I've said pretty frankly that will not be normal as we knew it before the lockdown for a long time to come. It will be a new normal, and this will be very gradual and very phased. But the sooner we can start to get some normality back, the better. But if we do that too quickly, we'll end up going backwards, and we'll be living with this restrictive lockdown for even longer, and that's in nobody's interest. So I'm asking people not to love this, but to stick with it, because we all know that together it really matters. Rachel Watson from the Daily Mail.
First Minister, just on the relaxing or keeping lockdown the same way it is, you mentioned an increase in the use of buses and roads recently. You say that you don't think that any measures will be relaxed next week. Could the government take action to bring in new measures or tighten them in a bid to stop people flouting the rules?
I'm not standing here with that intention right now, but again, last week when we published the paper, and if you read the paper, we very clearly say we can't rule out at some stage if what's happening with the virus makes this necessary of having tougher measures, but I'm not standing here right now planning that. And I suppose the most important thing I would say is that will become necessary only if we start, all of us, going back the way and allowing the virus to run out of control. So, the more we stick with what is here just now, that we reduce the likelihood of more restrictions in future. And actually, although I know it doesn't feel like it right now, but we will accelerate the point at which we can start easing these restrictions. And, I keep saying it, this is tough. It gets tougher with every day you listen to me saying this. I know you're feeling more and more frustrated, but you will feel even more frustrated, and rightly more frustrated at me if I don't say these things, and this time next week or in 2 weeks I'm standing up here giving you even grimmer statistics about the toll this virus has taken on people we love, on our communities, and on our own ability to live our lives. So I won't do anybody any favours by trying to soft soap this. I have to be honest with you, and I have to be frank, and even if that means sometimes brutally frank, and that's what I'm going to continue to do. Simon Johnson from The Telegraph.
I appreciate, obviously, you're being straight with people by telling them that next week there probably won't be any loosening of the lockdown. But is there a danger that will increase the frustration among people who can't see any light at the end of the tunnel and may be tempted just to say, well, stuff it, basically? And can you give people some hope that things will be better at the end of May than they are at the end of April?
I'm an eternal optimist. You might not think that from listening to me day in and day out, but I am. And the hope I can give people, I think there is light at the end of the tunnel. Don't get me wrong here. Every day for the last 2 weeks, I've been able, maybe with one or two exceptions with fluctuations, I've been able to stand up here and tell you that there are fewer and fewer and fewer people in our intensive care units. That is really positive. And hopefully, if that continues, it won't be too much longer before I'm able to stand up here and say the numbers of people who are dying is reducing as well. So there is light at the end of the tunnel. What I'm saying is, if we ease up prematurely, the risk we take is that we extinguish that light, and it becomes very difficult to see it again because we will go backwards. So if we stick with it, the light becomes brighter with every day that passes, and some kind of end point. As I keep saying, that for a while is not going to be like the day before lockdown when we lived completely normally. But we do start to get back to some kind of normality. And so please don't take from what I'm saying that I don't think there's any light there. But keep focused on that light and don't let it go out, is what I'm saying. And, we'll take the final decisions next week. I'm being frank with people. Right now, I would be very surprised if there's any substantial easing up next week. But with every day we stick with this, we hasten the day where I can stand up here and give you much better news. And I was going to say nobody is keener than that for me to be able to do that, but you're probably all much keener. But I'm very keen to be standing here giving you much better news than I am just now. So my message really is keep your eyes on that light and don't let it go out. Paul Mallock from the Courier.
Good afternoon, First Minister. I was just wanting to follow up on some comments that were made yesterday afternoon. I know you answered on the possibility of the islands being used as a testing ground or wouldn't be drawn to it. But Mr Gove down said the UK government would be acting as one if the islands were to be used, and MPs for the West Islands, Angus McNeill and Alistair Carmichael up in Orkney and Shetland, welcomed the ideas that the islands could be used. With that in mind, who would have the final say on whether the islands would be used as a testing ground on the restrictions of lockdown? And with the bearing in mind the comments made by MPs, MP Ian Blackford said that he would like to see the universal basic income introduced. If you had the power of the Treasury with the Scottish Government, would you introduce the universal basic income?
Well, in answer to that question, yes, I would take forward serious plans to do that, and I will, be seeking to get into constructive conversations with the UK government about that. I've long been an advocate of serious exploration of UBI, but I think the fundamental disruption that we're living through right now in the economy makes that an even stronger case. So I would like to see progress being made on that, with particularly substantial welfare powers still lying outside the remit of the Scottish Parliament, and obviously substantial tax powers. It's impossible for us to do it unilaterally, but if I had those powers, then yes, I would be seeking to make progress on that. In relation to your first question, look, we could, and I totally understand the appetite for this, but I want to bring forward proposals. When we bring forward proposals, I can stand up here and talk, or even early suggestions when we have been able to do the work that allows me to say, well, this is what we're thinking about. What do you think? And I'm not ruling out the islands being, I suppose, pilot areas or having things happen ahead of schedule, but we're not yet at the stage to rule that in either. So all sorts of things remain under consideration, and obviously we want to do all of this as far as it makes sense in collaboration with the UK government and the other devolved administrations. But in answer to your question, who has the final say? Well, in devolved areas, then the Scottish government, and in reserved areas, the UK government. But I hope we don't get into too many discussions like that. We should all be working together to do the right things, and that's what I will try to do. And if there are occasions where that means doing something slightly different for Scotland, well, I'll stand up here and explain why that's the case, and everybody watching can draw their own conclusions and make their own judgments. Tom Martin from The Express.
Hi, good afternoon, First Minister. Obviously, you mentioned sort of increase in traffic and bus levels. I just wondered, firstly, what's the picture on trains at the moment? And also, is it a sense of people are going out more for social reasons, or do you think there's an element of people feeling under pressure to get back to some kind of business work at all?
We'll get you the detail on trains. More generally, I mean, we don't know for sure. Obviously, there's a limit to how much we can gather data on people using. Obviously, we know from concessionary bus travel, because that is claimed back from the Scottish Government. So, and obviously Transport Scotland have ways of monitoring traffic on the roads. We can't tell, though, always why somebody in a car is in the car and where they're going. And I suspect it will be a mixture of things. People maybe go back to work in some cases, although I don't think there will be too much of that, or people just so fed up with being in the house that they want to get out. And again, I stress, I absolutely understand that. There is not a part of me doesn't understand and sympathise with that, but it all adds up. If we all start, if all of us decided to take one extra journey a week, then that adds up to a lot more travel, that adds up to a lot more people coming into contact with others, and suddenly this virus is a happy virus because it has got ways of transmitting that it doesn't have right now. And that's the risk, which is why I'm asking people, please don't do it. Do you want to add anything on the risks of allowing the virus to just run away with us?
So it's only a short time ago that I felt myself really concerned that we were sitting with a kind of estimated reproduction rate in the UK of over 3 and staring at increasing numbers, and I sense that many people, many more people than we've actually experienced, could be affected and could even die as a result of this virus. So to be where we are just now, to have reduced that transmission so far at this moment in time, I just, again, would express my gratitude to the population for the way that they behave, but also to encourage them, again, that the margins here are so low, are so tiny, that small changes in behaviours, so that virus, this very transmissible virus, this virus that is able to spread from one person to another with such ease, if we're not careful, if we don't take the distancing measures, the hygiene measures that we've all become accustomed to. But if we let up on that transmission rate will increase again. And we're not talking just about health services becoming overwhelmed here. What we're talking about is people being affected by this virus, people becoming ill because of this virus, people dying because of this virus, many more people than we currently see just now. We've got a sense that things are very encouraging, things are moving in the right direction, but small changes in behaviour can make a tremendous impact on that transmission rate just now and could see us going in the wrong direction again.
Thanks. Alistair Grant from the Herald.
Hi there, thanks very much. First Minister, you previously suggested small bubbles of people could be allowed to meet up as part of efforts to make life a bit less difficult during the coronavirus lockdown. Is there anything further you could say about that idea? For example, if ministers have considered how it might work, when it could come into force, how it could even be policed? Is this move or something similar to it something that we could expect maybe in the coming weeks, or is it something for the much more distant future? Because there will be many people, perhaps especially those living alone or who haven't seen their close family for weeks now, who will find the idea of restrictions continuing in their exact current form past May 7th very difficult to hear.
So, that kind of concept, which I spoke about last week, is one of many things that we have been looking at and considering. And I indicated when I made my opening remarks today that ahead of the review date of the 7th of May, I intend to give an update on the different considerations we've been undertaking as part of this early stage and what our assessment of them is and where they fit within this need to keep the R number under 1. So we'll try to do that in the early part of next week. But my assessment right now is that margin we've got is so narrow that anything like that right now may edge us over the crucial 1 number. I mean, we're all of you listening to this, and I'm in exactly the same boat here of learning more than I ever knew before about reproduction rates and how viruses operate. And one of the things that is, it's, for me, trying to get my head round and understanding just how tight these margins are is the very, very fine difference between the R number being just under 1 and therefore cases are in decline, and it being just over 1 and suddenly cases are rising again. And that is what makes these judgments so very difficult. Now that is not music to anybody's ears, but it's really important that I explain to you why these decisions, notwithstanding people's frustration and desperation for something like the bubble so that they can extend the people they're seeing, I understand that, but why it's not as straightforward. Because some of these things that people are saying to me, why don't we do X, Y, and Z? Taken together, they all sound quite small and gradual things, but on their own, they could make that difference, and taken together, they would certainly make that difference. So we will try to get to these things as quickly as possible. But in short, we need to suppress this virus a bit more to give us the headroom to start to do some of this. And we haven't suppressed it sufficiently. It's below 1, we think, but we don't think it's very far below 1. So we need to get it much lower. And then your room for manoeuvre becomes a bit more comfortable, and we can start actually thinking about some of these things. So it comes back to the most important point I'm making today, and everything I'm saying is stick with it so that we get it further below 1. And then we won't be able to throw caution to the wind and do everything we're used to doing, but we will have that bit of room for manoeuvre for some of these suggestions that have been put forward. Libby Brooks from The Guardian.
Hello, First Minister. This morning, Scotland's Children's Commissioner, along with a coalition of charities, wrote to supermarket chief executives, urging them to stop the challenging, barring and sometimes abuse that single parents have been experiencing when they try to do essential shopping with their children. What's your message for supermarkets and for the public on this?
No single parent should be abused or bullied or made to feel uncomfortable in any way about having their child in a supermarket if that is essential. When Professor Leach was with me the other day, he made a comment that I think some people perhaps heard him, not that, maybe he didn't articulate it clearly enough, but people got the impression that he was saying that nobody should be taking a child to a supermarket. So let me clarify that, as he has done already. I think ideally it would be better if children weren't in supermarkets just now, but we understand that for some parents it's not an option not to have your child with you because you've got nobody else to look after them. So yes, there will be some circumstances in which children have to be in supermarkets, and that is perfectly understandable. Their parents and the supermarket, as with everybody, should make sure that they are able to safely socially distance, but no single parent should be in any way made to feel uncomfortable about that. And that would be my message, not just to supermarkets, but to anybody in any setting or circumstance. Christine Lavelle from The Sun.
Minister, more than 6 weeks ago on the 16th of March, you announced... Oh, hi. Can you hear me now?
It's very faint. I'll try to, yeah.
More than 6 weeks ago, on the 16th of March, you announced community surveillance testing at 200 GP surgeries to track the spread of the virus. We've asked several times in the past fortnight for how many people have been tested under this system, and you've so far not said. Can you say now how many have been tested, or has this scheme been abandoned?
Well, as I've said a few times, we'll give a substantial update on testing tomorrow, so I'm not going to take up too much time going into that right now. But you will recall, I hope, that when we said we were going to expand the GP Sentinel surveillance system, the one that happens for flu every year, we were going to expand it. Subsequent to that, we took the decision, rightly took the decision, to establish COVID assessment hubs so that we weren't asking people with COVID symptoms to go to their GP. We were asking them to phone NHS 24 and then, where appropriate, be referred to hubs. So the surveillance system couldn't operate in that way with GPs. The surveillance system is operating through that assessment hub system, and that is the surveillance that has been done is increasing as part of our testing strategy and as part of our ability to learn more about how this virus is operating. But as I say, we'll give more of an update on numbers around testing at the briefing tomorrow. Andrew Learmonth from the National.
Good afternoon, First Minister. The father of one of our readers has advanced Alzheimer's. His wife, who is his carer, was hospitalised last week after a bad fall. So now the father lives with the reader, who also has 2 school-aged children and who's also trying to hold down a full-time job. There's almost certainly going to be people in even more stressful situations in this. Carers Scotland last week said that a reduction in services means unpaid carers fear they could soon burn out. They're struggling to understand what the new normal will look like for them. Can you help with that? Can you say what help you can offer unpaid carers? What help are you giving the sector to reopen services and day centres?
Hand over to the Health Secretary to talk about what we're doing with unpaid carers. I mean, I have enormous sympathy for the kind of situation you've cited there, and it will be replicated many, many times over across the country. I can't obviously comment on individual circumstances that I don't fully understand, but I just say again, my desire, my strong, burning desire to get us back to as much normality as quickly as possible. But that is equalled by my strong, burning desire not to allow this virus to claim any more lives than absolutely is unavoidable. And so those two things have to be balanced. And these are horrendously difficult judgments, and they're judgments that have to be made rationally, but there are judgments that are imbued with emotional considerations as well, and I think everybody can understand that. But the Health Secretary obviously is overseeing the work generally around care, but unpaid carers in particular, so she can say a bit more about that.
Thank you very much. So 2 things I want to say in particular that I think are helpful to unpaid carers. But before I do that, I think I probably need to start by saying that ever since I had the privilege of being a minister in government, I've had a close working relationship with carer organisations, and I, as much as I can, understand the considerable contribution they make, but also the considerable pressures that they face, because those pressures come as a result of their desire to help a loved one. And that is very difficult indeed. We have taken steps to ensure that unpaid carers can have access to the personal protective equipment that they need in these circumstances. We've also given a commitment to look very closely, and we're doing that now, at the recommendations from Carers UK, backed by Scottish carer organisations, about what additional support and help they think would be helpful. And the final point I'd make is this. I'm sure people who've tuned in before have heard me say very clearly that I find it unacceptable that social care packages that existed before this pandemic have been reduced and in some cases cut completely since the pandemic appeared, because I can see no good reason why that has to be the case. We have put in place financial support, staffing support, in order to allow that to happen. And some of those important social care packages are vital for unpaid carers because they offer a degree of additional professional support to them and therefore respite in the work that they're doing. On the final point about carers centres, where some of those that carers look after have gone in the past for lunch or for social activities or whatever, and obviously those right now are not operating. That will be part of what we think about, as the First Minister has described in detail up till now, and are looking at. But social distancing, physical distancing, will be for a long time part of what we all need to do. So we need to think through, and the providers of those centres and those services will need to be thinking through whether or not there is any possibility at any point when some of that could be available again, in what circumstances and with what safety measures around them to protect those who go there as well as those who provide that service.
Okay, thanks, Jeane. Vivian Aitken from The Record.
We told this morning how there is growing evidence of rat infestation caused by increased fly tipping and police officers' time being taken up having to monitor these illegal fly tipping sites. For the sake of public health and to ease the burden on our officers, will you sanction the reopening of recycling centres, taking into account social distancing guidelines?
We will do that if and when we consider it safe to do so, and you know that is the position with all of these measures. I was asked and addressed this briefly in Parliament the other day. We have also launched earlier this week a public campaign around fly tipping and the need to be responsible there. So we are very aware of these issues and clearly want to make sure that we take steps up to including reopening places to reduce the impact of this. Gina Davison from The Scotsman.
Thanks, First Minister. As you know, pupils across Scotland were due to start their exams this week. However, teachers and parents are increasingly worried about how any passes are going to be awarded given what are being called impossible demands that the SQA has set. Teachers and of course parents are concerned about potential moderation by the SQA of any results that teachers give to pupils. Do you, as First Minister, have confidence in the judgment of Scotland's teachers and that they're the right people who should be deciding whether children pass or fail this year?
Yes, I have confidence in the judgment of teachers, but I think in any system you would expect a degree of moderation. That's not about trying to substitute somebody else's judgment for the judgment of teachers. It's recognising that there is always human error and there will always be a need to have a system that moderates any approach like this. And the SQ have set out very clearly how that will work, and I'm sure we'll continue to be very happy to try to address concerns. I suppose the other thing I would say, which is obvious, it's not an ideal position to be in. I wish young people across the country, some of them will agree with me, some of them might not, but I wish young people were about to sit their exams. But that's not possible this year for the reasons that we know. So we have had to put in place another way of making sure that young people get the credit for all the work that they've done and are not disadvantaged. And SQA have done that. I have confidence in what they are doing, and we'll continue to try to address any reasonable concerns about it. Kieran Andrews from The Times.
Thanks, First Minister. The UK government has adjusted its criteria for moving out of lockdown from avoiding the risk of a second peak of infections to avoiding a second peak that overwhelms the NHS. Given how much you've stressed the importance of keeping the R number below 1, do you agree with this adjusted approach, and will it be part of the Scottish Government's approach to easing restrictions?
I think that's a really important question, Kieran. It's something I've been considering over the last couple of days. I don't yet know whether that is a sort of deliberate and meaningful change in that I think it's the 5th of the 5 tests the UK government have set out, and we'll certainly try to ascertain that. But if it is a meaningful change, it's not one I would agree with, and let me try and set out why. I think you probably can take from everything I've said from the start of this that not overwhelming our NHS is a critical objective. It's why protect the NHS is one of the things we say every single day. So take it as read that we must make sure we don't overwhelm the NHS. That said, though, while that is a necessary objective, I don't think it's a sufficient objective on its own. And let me illustrate that. I've just given you numbers today that say there's just over 100 people in Scotland in intensive care. But I also know that today we've got a surge capacity, if we needed it, of 585 intensive care beds. So if our only objective was not overwhelming our NHS, I could stand here and say, you know, we could afford to quadruple the number of people in intensive care, and we still wouldn't be overwhelming our NHS. But if we allowed the virus to spread at a rate that resulted in 4 times the number of people being in intensive care, then the virus would be spreading a lot faster than it is just now, and that would be resulting in many, many more deaths than I am having to report to you now. So it's not enough to say don't overwhelm our NHS, because you can change within certain constraints the capacity of your NHS. You also have to have an objective that says keep the virus as suppressed as possible. And that's why all along what we've been saying to you is help us slow the spread. Yes, help us protect the NHS, but help us save lives. And the save lives bit means keeping the virus as suppressed as possible. So that's why that's my view, and that has to be what drives us as we go into this next phase of managing it. Thank you. That concludes the questions. And if I can remind you again that tomorrow we will have a focus on testing. Obviously, we'll cover any other issues that are topical or relevant tomorrow, but we will set out 3 things tomorrow where our testing capacity is. Remember, for NHS labs, we set that target of 3,500. We will also set out how many tests that we have been doing at the end of this month, and also set out our next steps in terms of extending further eligibility for testing. And then next week we will look ahead to a test, trace, isolate strategy, because these 2 things are not exactly the same. So can I thank Gregor and Jeane for joining me today. Can I also thank, as always, our sign language interpreter, and thank all of you for joining us. We will be back here tomorrow at the same time of 12:30. In the meantime, please keep abiding by the rules, because it is making a positive difference. Thank you.